All right, thank you all for being here today on the panel. What we got is we got about 30 minutes, and what I did is I pulled up the panel discussion topics for the panel members in case they lose track of what they needed to talk about. Here's some of the things that we wanted you to get after: challenges, successes, opportunities, and hopes within your programs. And I'll introduce one at a time, and they can come up and tell us a little bit, or you can just stand where you're at with the microphone and address those issues. And then at the end, hopefully we'll have some time for discussion. So if you have something, a question for one of the panel members, we can get that asked. So first of all, we're going to have Jennifer Illick from First Link from Fargo. Jennifer?
So my name is Jennifer Illick. I'm the Director of Helpline Operations at First Link. I'm excited to be here today in a room filled with so many people working together to make a suicide-safer community. So I just want to take a few minutes to give you an update on First Link. I want to talk about our trainings first. First Link, we have staff that are trained to teach mental health first aid to those working with youth and those working with adults. We have staff that are trained to teach assist, applied suicide intervention skills training, and Safe Talk. We also do specialized training like a suicide intervention classes. 2018 was a record year for First Link training team. We've reached over 6,000 people in our training and presentations. And this includes 2,391 students in the Fargo-Moorhead area. Throughout the year, we presented trainings to like Minot State University, Standing Rock Mental Health Consortium, North Dakota Volunteers Against Disasters, North Dakota Emergency Medical Association, and the New Rockford Community Days, and many more agencies and many more other areas. If you have any questions about training, so if you would want your agency to present a training, you want to attend a training, they're listed on our website under myfirstlink.org. You can talk to me sometime today. And our education and training coordinator, Ashley, is also here, and she can answer any specific questions about training. We do have an assist coming up in Fargo, so we brought a brochure if you are interested in assist. It's at the end of this month. It's been a busy year for our suicide follow-up program as well. The suicide follow-up program is a voluntary program offered to people needing additional support. The referrals come from our 211 helpline, our National Suicide Prevention line, and from hospitals and clinics that we're teamed up with throughout North Dakota. We have been working with SAMHSA, Columbia University, and the Department of Health on this program. The primary goals for the follow-up program are to ensure physical and emotional safety of the participants, to empower and motivate participants to use resources that are available to them, and to reduce the service gaps by promoting continuity of care. First Link's follow-up program increased by 71% with the amount of outgoing calls from 2017 to 2018. So like in 2000, to show you some numbers, in 2016, we had 188 referrals that came in. In 2017, it was just over 1,000. And then in 2018, we had 1,500 referrals coming into our program to do callbacks out to people in the community that are discharging from healthcare facilities that have had thoughts of suicide. So I think the increase of numbers just shows why we're all here today, because our state needs this extra help. The amount of outgoing calls in 2017 was 4,800 outgoing calls, and then last year, 2018, we made 8,200 outgoing calls for this program. We also send out caring cards. It's an accredited practice to send a homemade card in the mail. We started in 2016, we had 316 cards that we sent out, and last year we sent out over 1,400 caring cards in the mail as well. Our grant through SAMHSA for this follow-up program is ending in June, so we're actively exploring new possible funding sources for this program. If you have any questions about the follow-up program, you can talk to me sometime here, contact our office. Francesca, our suicide follow-up program coordinator, is here as well, so she can answer all the questions. If the clinic or hospitals in your area are not connected with FirstLink for the follow-up program, link them to us, and we would love to sign an MOU with them and start doing outgoing calls for them as well. Also in 2018, we added texting to our services. We tried to do a variety of ways for people to communicate with us. Right now, our entire database is on our website, myfirstlink.org, so 5,500 resources that you can check out. People can simply dial 211 to get a call specialist at FirstLink. You can dial the Suicide Lifeline, but now people can text their zip code to 898-211. And you can text for resources and referrals, listening and support, crisis intervention. So far, we started in October to December, we had 68 incoming texts, so it's starting slow as we're getting the word out to people. So when I was listening, when Cora was talking, she said sometimes commercial ads, she feels like they're signs in the community. And I was thinking about what she said there, and I believe that North Dakota Cares and Department of Health did some ads for us. And we've had people that called us that said, I was having thoughts of suicide. All of a sudden your ad came on. I put the means down and I called you. Now what? What do I do now? So I just think it's so powerful when people are educated to know who they can call. So my challenge for you is tomorrow when you go back home to your jobs, go back to your jobs tomorrow, to just let your coworkers and the colleagues that you work with know about FirstLink. There were 24 hours a day. We're free, confidential phone support. We can link people to professionals in the community. Also tell the clients that you work with, let them know that they can call or text us anytime. And then put us in your newsletters. We have a lot of already made to go stuff, so if you want any newsletter information, let me know, and that'll even expand the knowledge of FirstLink even more. And the last thing I'm going to leave you with is just like Jeff said, we have a bill at the legislature right now, Bill 1329. It would work to enhance FirstLink's 24-hour service, education, and statewide services. So if you have a chance, try to help us support our bill. Thanks, everybody.
I believe FirstLink's a great example, of what Dr. Warren was talking about walking upstream and dealing with issues upstream. And they're not only about being there in a time of crisis, but they got resources. They know where the resources are at. They can connect people to the resources before crisis sets in. So please, refer folks, especially the providers out there, refer them to FirstLink to get them signed in to their database. It's real simple. They do the work. So we'll move along to the Veterans Administration from Fargo. We have Nicole Veselka. Did I get it close enough?
Veselka.
All right.
Hi, I'm Nicole Veselka. I'm with the Department of Veteran Affairs Healthcare System. I'm a nurse. I'm a veteran. I have the fancy title of Suicide Prevention, Education, and Outreach Specialist. The VA has made suicide prevention the top clinical priority, and we've had a lot of success within the VA, providing access, same-day mental health services, increasing telehealth services. This kind of goes in with our challenge of the ruralness of North Dakota. How do we get services out to people who are on the western side of the state when our main healthcare facility is in Fargo? But yeah, we've had a lot of success within the facility, within our whole health program. We are now offering integrative and complementary healthcare services. Kind of speaks to that fact that we cannot medicate our way out of our problems. We also offer a lot of the different evidence-based cognitive therapies, services such as that, group therapies, peer support. One of our big challenges is that 20 veterans die by suicide each day. 14 of them are not enrolled in VA healthcare. And so that kind of goes to my position being created And the VA has taken a public health approach to suicide prevention. And so we are partnering with family members, the community, peers, looking beyond individual veterans to how we can reach out and provide them support. I do want to touch on one program that the VA is providing within our facility, and that's the REACH VET program, and that's an acronym for all of you who are familiar with the military. The VA also loves acronyms. REACH VET, Recovery, Engagement, and Coordination for Health, Veterans Enhanced Treatment. This is a predictive analysis program that ties into our electronic healthcare system, and it takes data from medications, hospitalizations, suicide attempts, and diagnoses that increase someone's risk for all-cause mortality, including suicide. It takes the 0.1% highest risk individuals and places them on a dashboard. There are 2 REACH VET coordinators, I am one of them, and we notify the provider who is most involved in their care, and they review the chart, and then they look at ways to enhance the veteran's care. This program started in 2017, so we don't have a lot of data yet on decreasing suicide rates, but it is proven to decrease hospitalizations, decrease ER visits, and also people are more involved in mental health care. So it is an effective program, and it speaks to the IT bringing in that data, but you can't just have a computer or a program enhance someone's care. Then it gets placed in the provider's hands and the veteran's hands, and they're involved in patient-centered care. So back to some of our challenges is that we are engaging the community, and we want everybody to be willing to be there for veterans. We are trying to engage our faith-based communities. We're trying to engage our different healthcare facilities, veteran service organizations. We are engaging the National Guard, people who are currently in the service, as well as veterans who are out of the service, family members, and then just anybody who is involved in their social support. This kind of goes back to Thomas Joyner's theory of thwarted belonging. And we want everyone to be willing to be there for veterans and to feel that connectedness. It is a proven protective factor when you feel a sense of belonging and you feel a sense of community that can decrease the suicide rates. One theme I've heard today is providing education to our community. The VA also offers education to the community. We provide SAVE Gatekeeper training. It's about a 1-hour training. One thing I like to plug about the VA is I can come out, or another member of our suicide prevention team can come out. We travel across the state of North Dakota into Minnesota, our catchment area, and we provide this training for free. This is appropriate for all community members, so it's not just for healthcare providers. However, we can tailor our training to first responders, to clergy members, to whatever demographic, really. If you have a bowling team, we're willing to talk to anyone who is willing to support our veterans. I am also partaking in Project 5 of the state prevention plan, and that's focusing on veterans, service members, family members, survivors, and so I hope some of you will come to our table today and look at ways we can collaborate and really reach veterans before they're in crisis and have that proactive approach. Thanks.
Our last presenter on the panel is from Source of Strength, Mark Lomery.
I have a few slides up here. Anybody know where those went? Just real quickly. Hey, real quickly, everybody turn to your neighbor, give them a high five. Say, lunch is almost here. Okay.
High five.
Hey, there you go. Turn to your other neighbor, give them a quick double fist bump, and say, I'm glad you're still here. All right, there you go. Say real quickly while we're popping up a few, there should be something in your packet that looks like this. It's a waterfall. And I think Source of Strength basically is a program where we're training local leaders. And what we're trying to do is train adult advisors what we're training is what we call adult advisors, so local school personnel, community people that will be working with a peer leader team that will be going out and spreading kind of hope, help, strength messages. So we train those adult advisors, we train those peer leaders. We're trying to get, what we find is a tipping point is if we can get 10% of a population, so 10% of a school population is kind of what we're finding in the research as a tipping point. That seems to make a difference with things. So we've been partnering with the health department for the last several years. Right now, last year I think we ended with about 40 schools that had peer leader teams, about 1,800 students that were reaching out and providing a lot of messaging to about 18,000 middle school and high school students. So we're just with the support of the Blue Cross Blue Seal Community Partnership and Caring Foundation, they've added another 14 or 15 funding for another 14 or 15 schools. So we're going to be hoping that we're hitting about that 4,000 mark here in North Dakota of peer leaders going out and being able to spread messages to what we think is going to be somewhere in that 25 to 35,000 students, and they're providing repeated messages and what we call kind of hope, help, strength kind of messages, not sad, shock, trauma type of thing. So this is our wheel that we work with, and most of you have probably seen this somewhere before, but it's kind of a holistic model, and Don was presenting on the medicine wheel and how interconnected those pieces are. And so of course we have up here, medical and mental health support, which are kind of our institutional kinds of strengths that we need to draw from at times. But a lot of the rest of that wheel are about what we talked about, relational support. And so when we're looking at risks for suicide or substance abuse or violence or gun violence kind of things, isolation is a big thing. Feeling aloneness, feeling disconnected, feeling like you're a burden, is also another big one. Feeling like you're a drag on those other people around is also a big thing. And so if you look at the wheel here, you see that family support, positive friend mentors, are all things that are designed to kind of make people feel more connected. And our peer leaders are doing activities where they're really trying to draw folks in, making people feel like they belong, doing lots of different kinds of activities, sometimes just share messaging, but a lot of interactive stuff where they're talking about, hey, who's your strongest family support you have? Even if you got a really rough family, like we've had kids that, hey, both my parents are meth addicts, but they're able to talk about, no, it's my best friend's mom. She does all my mom's stuff for me. And that's their family support. And so really bringing it down to what does it look like where they live in their real world. Our concept is that none of us are making it through life without going through some good stuff, and all of us are going to go through some tough stuff, right? We're going to go through some rough things. And as we bring these strengths to life and we let people talk about what that looks like in their own world, in their own life, in their own school, in their own family, in their own culture and neighborhood, that's what we find is pretty powerful. And so as the peers share these stories in just real and authentic ways about what these strengths look like, that gets picked up. That's how things get spread and get taught to different groups across there. So we're primarily an upstream prevention program, and Don told the upstream story already, an analogy, but when we think of suicide prevention, most of suicide prevention activities are right at the waterfall edge. We're trying to intervene on people that are already suicidal. And so when we're talking about the great work being done by 211 and doing things with the depression screening tools that were trained earlier, and what we call gatekeeper training, some of those programs. Those are all things kind of right at the waterfall edge that have evidence, been shown to be effective, but also postvention. what do we do after we have a traumatic incident? And so sometimes those mental health services, those support kind of things. Source of Strength is designed to go upstream. That's the primary mission. We're trying to get to people before they become suicidal. And we're trying to do early help seeking, increasing those connectedness, coping skills, and support, and using those peers to kind of spread those things out. And so just showing you real quick, we do a lot with social networking. We're one of the most heavily researched peer leader programs in the world. And this is just an example of a live school in one of our recent trials funded by the National Institute of Mental Health. And if you look at this is a high school, and the red dots are students that have made suicide attempts, and the yellow dots are students that have had suicide ideation in the last year. And you might have a hard time seeing this, but probably the thing that jumps out at you most is we have red dots scattered around the whole system, right? But as we look at that, we've got a cluster of red dots over on the side. And these are friends of friends of friends of friends that have made suicide attempts. So sometimes where you fall, and so often what we've done is just talked about suicide as an individual, as a medical model type thing, as we treat that individual who has risks. But a lot of times what we're doing is we're really trying to change the flows and streams of the population. And so as we try to recruit peer leaders, it's really critical that we're getting a great diversity, and we have that cluster of red over on the side. It's going to be really important that we engage or recruit at least one or two peer leaders out of that group that can have some impact as they go. We're playing the Kevin Bacon game. Y'all know what the Kevin Bacon game is, 5 degrees of separation. Peer leaders basically have power to 3 degrees of separation if they're doing things well in the way it's intended. If they're just kind of average and not doing things well, they usually have just 1 degree of separation. They have influence over that one friend out there. But if they're really doing things in an enhanced and integrated approach, they can increase that out to 3 degrees of separation. And if you do a really creative job of getting those diverse peer leaders together that represent the whole community. And so just looking up here, one of our, we've been doing some research trials just in the last year. The things that are going on in North Dakota have been really, really encouraging. This year, about 30,000 peer leaders we've trained, reaching about 1.5 million students. And we've got a trial going funded by the Center for Disease Control in Colorado high schools. And we're looking at impact on violence, dating violence, bully, harassment kind of things. And it's a 2-year trial. But after 1 year, we had 7 areas of statistical significance. And what was interesting about this, we're seeing a decrease in sexual violence perpetration and cybersexual kinds of things, and a lot of those things that we all talk about. But what's really interesting about this trial is we're not talking about dating violence. We're not going into the class and having a whole thing on cybersexual stuff. We're talking, what does healthy relationships look like? We're drawing those stories out of them. What are ways that health and what does strength look like in your life? And really spreading those. And we're finding the side impacts are increasing, not just suicide type things, but also quite a few of these other risk areas as well. And, as we go into this, there's some data from last year. I think we had about 105,000 messaging contacts. When we interviewed our peer leaders, we had that 56% said they had personally connected a student that was struggling emotionally to a caring adult, somebody that could help them out, which we thought was really a pretty big behavioral number, that they'd actually gone and made that contact. 85% felt like they were really making a difference in those other areas. So if you want to find out more about this program, we also have an Air Force project going with that. We've got a research trial going with Native Hawaiians right now. We've got a project going in Australia under randomized control conditions things with a bunch of schools in New South Wales. We're working with refugee populations this last summer in Sweden using Source of Strength. We had our first Source of Strength program in Farsi, and that in Sweden's writing Source of Strength into some of their refugee programs. So there's a lot of flexibility in how that kind of wheel of strength can be used and implemented. It's really a story-driven program about developing local leaders to kind of spread these strengths throughout their whole community. So one of the things we know, different kinds of diseases infectious, right? It spreads. We know suicide can spread. We know violence can spread. We know bully behavior can spread. What we don't talk about is hope is contagious. We can spread that. And so our peer leaders are the patient zero of an epidemic of hope and strength, and they can go through their communities and spread this. It's possible, and it's really doable. We've watched that under really controlled research conditions. So that's kind of what we're all about. Thank you so much.
Thank you, Mark. Personal experience, my daughter has talked about Source of Strength. She's a Century High student, and she loves that program on what it stands for and what it can do for the kids. So thank you very much.